Hi, my name is Jenny. I'm an occupational therapist. I work on an acute stroke unit, so my area of interest is neurology. An average day for me would usually start off by going up to the ward, seeing who the new patients are on the ward, and then usually doing a joint assessment with the physios and possibly the speech and language therapist as well with the new patients. So looking at how their stroke has affected their ability to communicate, can they still move in bed, can they balance sitting on the edge of the bed, what is their thinking like, are they able to recognize things, are they able to use things correctly, what's their memory like, and that whole, it's a very detailed assessment which will take place over the course of about a week. We would, if they've had a large stroke, we would look at seating them in an appropriate wheelchair. That means they can at least sit up even if they don't have a lot of sitting balance, and then also just look at their cognition and trying to figure out how the stroke has actually impacted them. And then the big, I guess, focus with occupational therapy is looking at, so what does this actually mean for the patient? You know, where do they come from? What were they doing before? What do they want to be able to do? What are their roles in life? Are they a parent, a grandparent? Are they working? And looking at how their stroke will impact on that. And the ultimate goal obviously being set together with the patient, but it's about getting the person back to normal life again.
So what are some of the ways in which you work with patients?
So initially, after that initial assessment, you would need to establish with the patient what their priorities are, but usually it starts off with really basic, unglamorous stuff like being able to get to the toilet on your own, being able to get yourself washed and dressed in the morning, and those are the things that we would usually start working with. They're not very sexy, but you can imagine the impact that would have on someone if they weren't able to, they weren't able to get themselves dressed, weren't able to get themselves to the bathroom. Suddenly adults find themselves wearing nappies, and it's a very distressing time. So working on those things first, and then once they've gained a degree of independence and sort of respect and dignity back, then we would start looking at other things that are important to them, which might be, how am I going to get myself my breakfast in the morning, and then we would start looking at that. So the focus is very much on function, on what the person needs to be able to do, what they want to be able to do, and then enabling that to do them, and also focusing not only on the physical aspects of the person's functioning that would be impacted by the stroke, but also the cognitive. So the fact that they may actually be physically independent but no longer have the memory or the cognitive ability to make themselves a dinner, for example, or even a cup of tea.
Okay. So for you, what are the positives, the pros and cons of OT as a career?
I would say that the pros are, it's a very holistic profession, so you really look at the whole person. You don't, focus on things in isolation. You can really make a huge difference to someone's life. You can really, have a positive impact. And it's very challenging. Certainly in neurology, there's lots of things to try and figure out if they're not doing something, why they're not doing it. So you're kept on your toes. No two patients are the same, so that's also great. You can never complain about feeling bored because all strokes present differently.
What about downsides?
The cons, I would say, it's not particularly glamorous profession, so you need to be willing to kind of roll up your sleeves and get down and dirty sort of thing. You're working in a team, so you need to work on sort of earning the respect of your team members, and that can be, sometimes that can be challenging, not always. People always say to me, don't you find it depressing? I don't find it depressing at all, because you start with someone who's had some tragic event, some devastating event, and you actually work from there. And so most times you're able to, together with the patient and the other therapists and the doctors and so on, improve that person's quality of life and hopefully get them to a level that they can accept.